Malaysia implemented a nationwide partial lockdown (MCO) to decrease the disease transmission rate, which in turn helped to reduce the burden to the country's health system. The nationwide lockdown had restricted the movement of the public and high-risk groups, for example, peddling religious congregants. Later in the pandemic, MCO and AMCO were implemented in areas with a sudden increase in COVID-19 cases. In short, various types of lockdowns were implemented in Malaysia in response to COVID-19 with the goal of targeting different epidemiological scenarios that were going to occur, as well as based on experiential learning.
Hi, my name is Damia Zahira. Today I'm going to explain about the effect of COVID-19. There are 4 effects of COVID-19 on our society. The first one is the activities of the society abroad will be affected and altered. Gate at the entrance and exit will be closed because of Malaysia. As a result, they won't be able to travel or conduct business abroad. Secondly, the income of the society will also be affected. When the government declares a lockdown due to the spike in cases, for instance, a small business owner is forced to stop operation, they will begin to struggle from a lack of food and supplies. Apart from that, the majority of the people who are unable to work for 1 or 2 weeks run the risk of losing their job and might turn into poverty. Then it will give an effect on our everyday work. This occurs when the lockdown forces all business to close. They must conduct their work from home. Working from home is challenging because it is challenging to deliver presentation, making discussion, especially if the work needs to communicate a lot in order to make decision. Someone with limited gadget access was also unable to work at all time due to the limited gadget. Working from home is difficult and full of distraction. For instance, noises from television or your child. Lastly, the rate of mental illness also rising. Many people have expressed their psychological suffering as well as signs of post-traumatic stress disorder, anxiety, or depression. When we worry overly about something, anxiety will develop. For example, some people have been affected significantly more than others. Young people who left exposed to social separation or disconnection as a result of prolonged school and university closure. This condition can worsen the feeling of worry, fear, and loneliness, and that result to psychiatric problems. Being ordered to stay at home may also raise the likelihood of family stress or abuse, which become the risk factor for mental health issues. Additionally, losing a loved one, such as parents or siblings, could also be the factor. Thank you.
Hi, my name is Muhammad Salihi. Today, I'm going to present about precautions of COVID-19. The best way to prevent spreading the disease is to avoid being exposed in the virus. Here are the best way that can help reduce the spread of COVID-19. The first one is get the COVID-19 vaccine if you are eligible. The COVID-19 vaccine is risk-free, efficient, and cost-free. The vaccine is beneficial for everyone who receives it, but it is crucial for those with a higher risk of getting a severe illness from COVID-19, such as pregnant women, older adults with a certain medical condition. So the second one is wash your hand with soap and water for at least 20 seconds after any activities. This included coughing, blowing your nose, etc. Hands should always be washed before eating or cooking. Use a hand sanitizer with an alcohol base if soap and water are not available. Avoid using unwashed hand to touch your mouth, nose, or eyes. So the third one is wear a mask or cloth face covering. If you are not fully vaccinated or 2 or older, you should wear a mask that cover your nose, mouth in indoor public place. A cloth face covering may not protect the wearer, but it may keep the wearer from spreading the virus to others. To reduce the spread of COVID-19, the CDC recommended that people in areas with high number of COVID-19 cases consider wearing a mask in crowded outdoor settings for activities with close contact with others who are not fully vaccinated or in situations where social distancing measures are difficult to maintain. Number 4 is maintain social distancing. Work from home if possible and avoid crowd and poorly ventilated indoor space. Maintain a distance of at least 1 meter between you and people who don't live with you. Avoid social touching such as handshaking and hug. Try a hand wave or a smile instead. So, number 5 is clean high-touch surface regularly. Clean and disinfection frequently. Touch object and surface like table, doorknob, light, switches, desks, and etc. The last one is cover cough and sneeze. If you are wearing a mask when coughing or sneezing, put a new clean mask as soon as possible or wash your hands. If you are not wearing a mask, cover your mouth or nose with a tissue or use the inside of your elbow. Throw used tissue in the trash and immediately wash your hand with soap and water for at least 20 seconds or if soap and water are available, use an alcohol-based hand sanitizer. So that's
Assalamualaikum, my name is Alauddin Helmi and today I will present about my part which is a struggling of foreign liners. So the challenge of face healthcare provide which consists of 5 sub-teams. So the first one is battling with inner physiological disturbance. For instance, they feel frustrated with their behavior, those in their community who disobey the order to stay at home. So the second one is the provision of PPE. In the first week of COVID-19 cases, there was a worldwide shortage of PPE, which caused management to restrict usage of PPE is this essential service that directly involve COVID-19 cases. So the third one is administrative and work adjustment. Workloads were increased, especially for nurses who had to change their work schedule from 8 hours per day to 12 hours per day. Since they work in their departments, they also need to learn and adapt to unfamiliar environment. So the fourth is screening and symptoms of COVID infection. High laboratory test costs and limited resources for swab test screening due to the increasing number of COVID-19 cases have influenced health staff members' access to COVID-19 screening. So the fourth, management of confirmed probable case. Management of high-risk COVID-19 painting is different from the usual case and takes longer. Staff have to prepare well before receiving the painting and need to clean the room after the painting left. Thank you.
Hello, my name is Dexa. I will present about the impact on education coronavirus COVID-19. Coronavirus affect the education system in the world. School, college, and universities are close to control the spread of the coronavirus. School closed bring difficult for students, teachers, and all parents. So, distance learning is a solution to continue the education system. However, the lack of networks, infrastructures, computers, and internet access is challenging distance learning in developing countries. The paper aims to review impacts of the COVID-19 pandemic on the education system in developing countries. Countries design strategy to use educational technology, zero fee internet educational research, free online learning research, and broadcast teaching. During close for the college, universities, educational institution designs curriculum, prepare teaching learning strategies for the post-coronavirus. Prepare teaching the educational design strategies to recover lost learning and return students to school when schools reopen. Coronavirus has been impacting the face-to-face education system of developing countries. Therefore, developing countries should broadcast teaching, online teaching, and virtual class infrastructures.